It's important to replace a missing tooth because, if left untreated, the adjacent teeth will shift and tip into the missing tooth space and cause a big misalignment in your occlusion. Your occlusion is the way your teeth come together. If you have one or more missing teeth, it's important to replace them. And we are lucky that we now have dental implants at our disposal. A dental implant is simply a titanium medical device that gets gently placed into the bone to replace the root of the missing tooth. When you come into our office, we will do a careful clinical examination, and we will cover with you all of your options you have as far as replacing a missing tooth. We will then typically take a 3D cone beam scan so we can assess the available volume and quality of the bone that we have to work with, so that when we go to do your project, we know the exact size, the exact width of the implant, the exact length, and the angulation that it needs to be put in, so it can best help reconstruct and hold the bone and give you a replacement for your occlusion, for your bite.